Thank you, Sahil, for those nice words of introduction. Ao, padaro, welcome. Aiye, ya, namaskar, namaskaram, sat shri akal, walaikum salam, a big hello. I just cannot help but to welcome you all in all possible languages that I know, as I'm sure today we have the entire India locked in. Who says miracles don't happen? Trust me, miracles do happen, especially when API, that is Association of Physicians of India, your favorite association which is so vibrant, association which is so academic, association which is known to give one after the other quality program. When such association joins hands with corporate houses like Dr. Reddy's, miracles do happen, especially when you all decide to give your time. I'm associated with Dr. Reddy's for a number of years now, initially unknowingly through their legacy brands like Stamlo, Omaze, Nice. And over years, my association with the corporate house, as I know, Reddy's is going to be a sure partner for any academic activity. And at API, we've had pleasure of joining heads with them and doing a couple of interesting projects for medical fraternity as well as community. This particular event, that is talk on hypertension that we're going to have today, took shape when we had a very casual discussion. And I remember when I was talking to Mr. Sahil, their head marketing, about this particular program, he got very serious about it. That led to chain of events. And again, another close friend of mine who currently is their India head for Reddy's business is Mr. Sandeep Khandelwal, who got into action. And you can see the finished product is in front of you. As I understand, there are going to be 25 doctors who will be logged in eventually. And I'm so happy to see so many live logins today. Trust me, it's only your presence that makes this program a special one. I must not forget the help that we are getting from Syntimed in giving us this platform. I'm associated with Dr. Ashwin of Syntimed, and I've enjoyed this association for the last couple of years. Today's event is very special to me as we are talking about hypertension management. Whatever be your specialty, irrespective of that, you cannot miss picking up hypertension and you cannot avoid treating hypertension. You may not have ECG machine with you, you may not have pulse oximeter with you, you may not have an audiometer with you, you may not have a peak flow meter with you, you may not even have an X-ray viewing box with you, but trust me, there are two essential tools that you must have. One is a stethoscope and second is a BP instrument, to the extent it's become our identity. And this itself talk about magnitude of problem. You can imagine how common this, how prevalent this problem is that we are talking about. Last year's theme was on this particular World Hypertension Day was to measure your blood pressure accurately, control it, and with that live longer. So let's invest next 30-35 minutes into understanding of this newer concept of blood pressure management, and especially in your capacity, in the sense at the individual clinic, at the individual place where you're practicing, how to best manage blood pressure. And I promise to make it as simple as possible. It is going to be one of the best time investment you had in some time. With that, allow me to share my screen with you. You may ask me, what is the need for prioritizing this hypertension management? Do I need to tell you that it is one of the biggest cause of death? Hypertension. We all have seen during this unprecedented COVID time, all those patients who had comorbidities like hypertension, like diabetes, like any other thing, suffered more. You're seeing all your patients who have complications have a silent killer, and that is hypertension inside. Every house has a case of hypertension now, and that talks about the magnitude of problem. It is a significant health burden. And a simple tablet, a simple pill can control hypertension and can save a lot of lives. And hypertension is not just managing those numbers. It is also managing those complications that over years it leads to, and your brain, your heart, your kidney are at a higher risk, and not to forget your retina. Hypertension control is extremely simple, extremely affordable, and above all, it is essential. And I'm very happy to present to you the Indian Hypertension Control Initiative, a 5-year initiative involving a lot of stakeholders like Ministry of Health and Family Welfare, Indian Council of Medical Research, Indian government, and WHO together. Before that, let's have a simple checklist, a simple way to understand how do we take our blood pressure. There are various habits going on in taking blood pressure. Somebody may want to take it in supine position, somebody in sitting position, and let's standardize our blood pressure taking methods. So if you must ensure that your patient is not exercise, he should not coming running to you. He did not have tea or coffee, or he should not have had tobacco in last 30 minutes. It should rest comfortably and quiet for 5 minutes before reading. That patient must sit comfortably with back support, with arms supported. There should not be any talking in between. Cuff should be at the heart level, and one must use the correct size of blood pressure cuff. You know that you have a medium size, a large size, and a small size. And ideal cuff bladder length should be at least covering 80% of your arm's circumference, and it should have width of about 40% of upper arm. So these are simple techniques of taking blood pressure. And if you want to go into the details, I've given the link there. You can just type IHCI training manual on your Google, and it will take you to this simple way of taking blood pressure, because blood pressure taking is art. Though we do it in day-to-day practice, but unless we take it in a standard way, we are bound to, we may be making mistakes. Allow me to present this simple protocol. A lot of doctors ask me, how do we begin blood pressure treatment? If you pick up hypertension at our OPD, what I suggest is, if you follow this particular standard way of taking blood pressure, and if you find your patient has got hypertension, by that I mean if his systolic blood pressure is about 150, 160, and diastolic is about 100, 110, you are talking about hypertension management, and this patient must initially be put on amlodipine 5 milligram on the very same day. You must investigate this patient with minimum investigations. But if you're convinced this is primary hypertension, or it is essential hypertension, or this patient does not have any major cardiac, renal, or cholesterol lipid abnormalities, you can initiate this patient on amlodipine and reevaluate them at the end of 30 days. If you have situations, do ask for all possible investigations, including your blood biochemistry, your baseline ECG, routine evaluation of urine, and your fundoscopy. This patient may have obesity, they may have cardiac disorder, they may have a sleep apnea as a cause of blood pressure. But in situations where this kind of tests are not possible, or by the time you prepare your patients to be sent for all investigation, I urge all of you to put them on amlodipine 5 milligrams on the very same day. You call this patient again after a month with all those possible lifestyle changes. You ask him to cut down on his salt, you ask him to take good rest, you ask him to do good exercises. And if you find this blood pressure is still high, you step up this 5 milligrams of amlodipine to double the dose, and it is 10 milligrams. After about 30 days, if you find this patient's blood pressure is still high, you would add another molecule, and that is telmisartan. I'm going to tell you why in next slide. But you initiate telmisartan 40 milligrams, another month evaluation, still blood pressure high, you double the dose of telmisartan, that is make it 80 milligrams. And after that, if still your patient blood pressure is found to be high, you put them on hydrochlorothiazide 12.5 milligrams, you could increase to double, that is 25 milligrams. And the highest dose in this combination is, for the recommendation of IHCI, is 10 milligrams of amlodipine, 80 milligrams of telmisartan, and 25 milligrams of chlorthalidone. If you're not able to use chlorthalidone, you may use hydrochlorothiazide. That means you can choose those diuretics as per the requirement. This treatment protocol is for initiation of hypertension treatment by IHCI. This offers effective and low-cost solution for control and treatment of hypertension and associated condition, specially designed for you and me, specially designed for rural India. And the primary objective behind it is to expedite the availability of treatment services, because otherwise you may lose these patients, or there may be delay in putting them on antihypertensive treatment with their own set of complications. A lot of friends ask me, Agam, why do you recommend amlodipine as your first line treatment? I'm convinced as my choice as first antihypertensive would be amlodipine. And I'm going to tell you why. It is one of the long-acting calcium channel blockers, and hence it has a potential for keeping your blood pressure under control for one full day. After initiation of 5 milligrams, you have a choice of going up to 10 milligram depending on patient's requirement, and still you could use it on once daily dosing because it has got high flame, making it very convenient for your patients to take it. You will agree with me, if you give them frequent dosages, the compliance may be low. Patient may forget to take tablet, which leads to a lot of fluctuation in blood pressure. But amlodipine is one drug where you can give full dose as one time dose, because it has a fantastic long half-life, would cover your blood pressure for full 24 hours. And my years of experience tell me, yes, it is safe, yet is well tolerated, and yes, it is a good drug where you can combine all other molecules if need be. So if I have a need for combining a telmisartan, I can do it. If I have a need of combining, say, for example, diuretic, I can very well do it. And this would be a good drug for monotherapy or as a part of polytherapy. If your patient's blood pressure is not under adequate control with 10 milligrams of amlodipine, you have a choice of adding one more molecule, and there is a reason behind. Because compared to monotherapy, when you give another molecule with different mechanism of action, will have a synergistic action in managing your blood pressure. So there'll be greater blood pressure reduction compared to monotherapy. It would lead to more frequent blood pressure control. That means the chances of failure will be less. And of course, there'll be better compliance to therapy. IHCI recommends dual therapy, and it recommends that one must think of using telmisartan in patients with inadequately controlled blood pressure who's on 10 milligrams of amlodipine. Starting a second medication before adjusting the dose of first may lead to more significant reduction in blood pressure compared to increasing the dose of initial agent. And hence, over years, we have realized rather than increasing amlodipine from 10 milligram to 15 or 20 milligram, if you add a drug like telmisartan in the doses of 40 or 80 milligram as per the requirement, it will lead to greater blood pressure reduction, better blood pressure control, better adherence, and your chances of going wrong would be minimal. And there comes a very interesting concept of this circadian rhythm. What is circadian rhythm? Circadian rhythm is, as you have a day clock, you have a morning, noon, evening, there is an internal clock, or there's a biological clock, which also goes through a 24-hour cycle. This rhythm play a very crucial role in managing various body functions, and one such function is your blood pressure. The daily pattern of blood pressure has a morning increase. So generally there is a morning increase when you wake up, and it slightly goes down during your sleep time. And in healthy people, there could be fluctuation of about 10 to 20% of blood pressure, systolic blood pressure during night time. And monitoring blood pressure throughout the day is crucial to account for nocturnal fluctuations in blood pressure. They may occur over 24 hours. And hence, if you have a patient, there is a warning there that if you have a patient who do not manifest this decline of about 10% in their blood pressure, they may be at an actually high risk of chronic kidney disease and other end organ damages, including cardiovascular events. And hence, this is the kind of circadian rhythm which you and me see in our patients. So if you have a habit of taking a patient blood pressure during morning time, and if you get a chance to look at their patient blood pressure during evening time, you will see that effect of circadian rhythm. Why it is crucial to strategize or focus on addressing time for blood pressure management. So having higher blood pressure at night is linked with greater chance of experiencing cardiovascular events such as stroke and heart failure. And everybody present here have realized, you may see that a lot of patients have complication during sleep time. A lot of patients have stroke during nocturnal time, during morning time, and hence tailoring your antihypertensive strategies or antihypertensive tablets, antihypertensive treatment, especially to target this nighttime blood pressure also is crucial. And hence, when you check blood pressure during different time, you realize there are some patients who require this kind of intervention, as this a simple measure, a simple advice on changing their tablet timing could effectively reduce overall cardiovascular complications, which is associated with nighttime systolic blood pressure. And then your next question would be, then can you give telmisartan at nighttime? And my answer is yes. There are enough studies which tell you that yes, evening or the bedtime telmisartan could have advantages. There are potential benefits of taking telmisartan at bedtime compared to morning dose. And I quote, it improves sleep time, relative blood pressure decline towards normal pattern without loss of 24-hour efficacy. And hence your blood pressure control is better, and it has a better 24 hours efficacy. It achieves significant better regulation of your nocturnal blood pressure. That means your nighttime blood pressure is better managed when you give them telmisartan as nighttime. And hence that makes it very simple for me. I would give amlodipine in the morning and I would give telmisartan in the evening to get advantage of entire 24 hours with better management of this nocturnal hypertension. That is, this nighttime elevation of blood pressure would better manage when I give amlodipine in the morning and telmisartan in the evening. And that's your next question. What is the appropriate time to take amlodipine? I have my preference for taking, though there are different school of thoughts and a lot of people believe that circadianism may not play a role, but I feel, and I quote, there are some studies which talk about it, and there is no harm in just changing a blood pressure tablet timing to get better outcome. Morning administered amlodipine has better effect on daily blood pressure patterns compared to evening administered amlodipine, especially in individuals with mild to moderate essential hypertension. When you have your patients who require dual therapy, when you put these patients on treatment, there is no harm in putting him on morning amlodipine, because there are some studies which reported that 24 hours diastolic blood pressure load and nighttime BP load was significantly greater with evening doses compared to morning doses. So you are giving same tablet if you give in the evening time and morning time, but if you give it in the evening time, the blood pressure load and the nocturnal blood pressure load would be higher. And then just by shifting it to morning time, you can achieve better control. Also, the nocturnal fall in blood pressure was greater with morning dosing than evening dosing, and hence you will achieve better evening blood pressure with morning doses than in evening doses. Will this chronotherapy or will this time-based therapy help you in just adjusting those numbers, or it will have impact on the end organ damages? Oh yes, chronotherapy helps in reducing cardiovascular events such as stroke, such as heart failure, just by simple nighttime administration of hypertensive drugs. It is shown to be associated with a decreased night hypertension and overall improved outcomes. And the study I quote is by Hermida et al., which is reported in 2020, and then there are references given at the bottom. Ingestion of blood pressure lowering medication at bedtime resulted in significant, and look at the number, 45% reduction in cardiovascular disease outcome compared to taking them in morning upon waking. And hence, just simple adjustment of amlodipine in the morning and telmisartan in the evening, if it helps you in reducing even a small number of cardiovascular events, I think it is worth an exercise. Do you think it will have any impact on CKD? And yes, data says just by changing the time of administration of these antihypertensive medications in individuals with CKD, that means your patient of chronic kidney disease, including those with severe renal dysfunction, that means your CKD stage 4, CKD stage 3, it leads to restoration of the circadian blood pressure variability. And it gives you additional renal protection, which is evident by decline in the eGFR. That means you know that when you measure that eGFR, the decline may also be reduced by simple adjustment in the antihypertensive drugs. And hence a preferred treatment plan for CKD involves, that means a patient of kidney failure, treatment plan would involve taking hypertensive medications at the bedtime, coupled with thorough patient's evaluation to confirm hypertension diagnosis. But you must be watchful. This patient must not get nocturnal hypertension. So you have to choose your patient. But yes, by following this biological clock or the circadian rhythm or something called as chronotherapy has a potential advantage not only in your so-called essential hypertension or the stable, so-called stable patient, but also in patients who've got advanced disease like renal failure. In rural India, amlodipine and atenolol combination is preferred as first-line therapy was the question asked to me. And I agree. Yes, there is an advantage of giving this combination because it is available at a lot of primary healthcare center. It is low priced or it is easily available. It is cheaper options available. And due to this low price as a single pill, it is one of the top selling hypertensive medicines, especially in private healthcare or especially in the rural India. And many patients receive this treatment free of cost from public healthcare facilities. And hence they are at a higher possibility of receiving this combination. Atenolol is approved drug for hypertension, but it is generally preferred for treatment of, say, I would say irregular heartbeats. However, according to IHCI, that is our Indian Hypertension Control Initiative, atenolol should not be the initial drug of choice for management of hypertension because atenolol has its own set of problems like loss of libido, your sexual desires could go down, higher cardiovascular mortality. There are some studies which talk about it. Least effective antihypertensive agent and cannot be preferred in elderly. It should be avoided in that small subset of patients who've got asthma. If you have asthma, nasal polyp, they have a higher chance of developing this beta blocker, especially the previous generation, the non-specific beta blocker induced bronchospasm, and hence avoided. And not to forget, it's a beta blocker would lead to bradycardia. And I've had a lot of patients who had significant bradycardia, and hence probably this kind of drug has its own limitations. If I can use this platform to give some message on this World Hypertension Day, I would say that we doctors don't get excited by that Rose Day, or we don't get excited by Chocolate Day or the Teddy Day or Valentine Day. We get pleasure in celebrating days like World Tuberculosis Day, World Hypertension Day, World Kidney Day. And these are the days where we get chance to connect with you all. As we use this opportunity to spread awareness about subjects which are very close to our hearts. I, on behalf of API, urge everybody to make the best of today. Do spread awareness about hypertension. Do celebrate it in your capacity. Talk about hypertension, talk to your patients, talk to communities, do camps, give media interviews, send your, what is that, Insta reels on it, make a YouTube video, find out your ways to sensitize society on hypertension. I would consider my efforts useful if you measure blood pressure of all your patients today the way we discussed about the right way of taking blood pressure. If you can pick up one new hypertension patient and put him on the right kind of treatment the way we discussed, you would make a big difference in that patient's life for sure. And it would have a big impact on society, on the future of our society. And that would be most satisfying reward that I would get for my time investment. In the end, namaste, avjo, bye-bye, alvida, sayonara, bidaya, vita, Piriya Vitu, and Vidisupatanu. Thank you. Seeing off.